All right.
Yeah, I think it's coming through. Redirecting to Facebook Live. All right, everybody, we are coming back online with Josh Hartman. So we are back. There's probably going to be a little bit of a delay. I think what I will do is I will go ahead and mute this out, or actually I'll close it out on. Yep, there it goes. That's, yeah, so I'm coming out there and I'm just going to stay over here on Zoom, and I'll just stay on my tablet because I can get in trouble with that. So I'm not going to do that again.
No problem.
All right, everybody, thank you for staying with us. This is Debra Anderson from Light of Gold Pure on the Gold Wellness Circle. And we're here with Josh Hartman, a wonderful paramedic on the front lines. And he was just sharing with us everything that he's seeing out there, which is incredible. I mean, obviously something that's never happened before. And so I'm trying to remember where we left off, Josh, before I got kicked off.
Yeah, we were talking about the timeline and how it all started back in China in January, and we worked our way through here now. So, for example, we just passed the dubious number of 1 million confirmed cases in the United States. 1 million, over 60,000 deaths, but 150,000 recoveries. So that's at least a silver lining there, right?
That's wonderful.
Yeah, New York, 300,000 cases, 18,000 deaths. New York City, 165,000 cases, 12,000 deaths.
Oh my God.
But what I was saying right before we got disconnected was that the rate of new cases and the rate of death is declining. And that's what we like to see. We want to see a decline. So there are still an increasing number of people who are getting the virus, albeit less than previously, but the rate of that incline has decreased, which is at least the beginning of a good sign, right?
Yes. Yes, that's a blessing. That's a blessing. There is definitely a silver lining. And I think that's important for all of us to really focus on, is that the curve is flattening, right?
Yeah. And it's because there's been a resolution by society to take heed of these governmental decrees or declarations to be in your home and to stay in your home unless you are in need of medical assistance, need to go to the grocery store, the pharmacy. Of course, those are very important and essential responsibilities. But the reason that the curve is flattening and the reason that there's a decline in the rate of transmission and therefore patients and death is that people are heeding that cause. They're staying at home, and that is very, very important.
Yes, it is important. So can you give us an idea of even what you've seen as far as like someone that comes in that you're, helping them get into the hospital and they've been diagnosed with COVID? I mean, because I noticed that with the symptoms, everything that we've been hearing, there's like no one symptom, it's like a couple of different ones. Everyone reacts differently. Can you share that with us?
Sure. So the general symptoms remain the ones that we've heard of most, which are fever, a dry cough, and body aches. Those are the key main symptoms. It doesn't mean everyone has those symptoms. It means the majority of people have at least one, if not 2 or 3 of those symptoms. But Debra, as you just alluded to, we've seen a vast expansion in the types of symptoms that patients are having. To include gastrointestinal problems. We see people who are having difficulty breathing as a sort of later stage. So it's not just your fever and your cough. And so for some patients, they skipped right past the fever and cough and got to having trouble breathing, whereas other people never had a fever, never had a cough, just had very sore, as if they just got out of the gym. And they're very like the morning after you go to the gym, so very sore. So I'd say that the symptoms you really want to look out for are the body aches, the fever, the cough, But the other symptoms did include certainly difficulty breathing is a serious symptom and one you should immediately seek help for. And others are such as GI or gastrointestinal problems.
Right. So what about the other symptoms like the loss of smell and taste and the
Mhm.
symptoms like, well, I've even heard about like body aches,
Yeah.
or lower back pain and those types of symptoms. Do you see those typically or are those a little bit more rare?
So it's interesting. The body aches we see pretty frequently. The taste, lack of smell, that's a little bit less frequently, but certainly well documented amongst patients who contracted the COVID virus. Hi, everybody. I don't know if you're still there. We'll wait for Deborah to come back in. I will play host and guest at the moment while she tries to dial back in. We were just talking about symptoms and which symptoms are more or less common. And certainly the back pain that Deborah was referring to can be considered part of the body aches. And so I'd say that the body aches is a relatively common symptom that we're seeing with COVID patients. I guess in the meantime, until Deborah gets back, I can start to answer some of the questions that came in. What should I do if I had close contact with someone who tested positive for COVID-19? What should my first steps be? So that's an excellent question, very practical. I'd say that if you had close contact with someone, then the first thing you need to evaluate is whether or not you have symptoms. And we just talked about all the possibility of symptoms like the fever, the body ache, the cough, lack of taste or smell, all those. If you are symptomatic, the first thing you should do is isolate yourself. You want to keep yourself away from other folks so that you don't infect them. So that's really the first thing that you want to do because you want to keep anyone else from getting infected. After that, so let's say you don't have any symptoms at all. So if you don't have symptoms, then you should continue following all the guidelines so that you're compliant, such as being in your home unless you need to be out. But you don't need to isolate yourself from anybody else. When you're out in public, though, you should wear a face covering, and that could be a bandana or it could be a mask, but it should be some sort of face covering because we are learning more and more about the virus and its transmission. And what we're learning is that the virus can transmit from people who are asymptomatic, meaning that they don't have symptoms. So we don't want you being asymptomatic and probably at pretty low risk to transmit it to someone who might be in the supermarket and more easily getting the virus. So if you're asymptomatic, you should do exactly what the government is saying. And if you go out, do wear a mask or something to cover your face. We are getting to the point where testing is much more available. And so if you have access to testing and you're asymptomatic and you want to know because you came in close contact with someone who was symptomatic, that you want to get tested, you certainly, if available to you, you can get tested so that you'll know whether or not you contracted the virus. Another question was, what kind of tests are there? There's multiple different types of tests going on, and they'll continue to evolve. The most common one had been the nasal swab, where they take a very long Q-tip into your nose, and then that test comes back in a couple of days, and that test tells you whether or not you are positive for the virus itself. Then there are also the immunoglobulin tests. And the immunoglobulin tests are really to see whether or not your body has built antibodies into its system so that we know whether or not you contracted the virus. So there are different antibodies that you would identify. One is antibody that tells you basically have the virus now, and another antibody is telling you that you contracted the virus. Your body built up some more potential immunity. We'll get to that in a minute. And so it's you're asymptomatic. You will have had the virus in the past, but you don't have the virus and you're not likely to transmit it anymore. So those are the different types of testing. Deborah, I was just answering some of the questions while you were coming back. Yeah,
You're
so we just talked.
You're such a great co-host, Josh.
Oh, my pleasure. Yeah, so we just talked about what would happen. The question was, if I had close contact with someone who tested positive, what should be my first steps? And we talked about those. And so the next question had to do with who's most at risk. So that's a very good question, because the evolution of the answer to that question continues to evolve. So when we first heard about the virus in Wuhan, China, we thought, like most viruses, this is going to really be contained to populations who are at risk. And those populations are generally the elderly, people who have compromised immune systems, such as people who are on chemotherapy, or comorbidities. Comorbidities is just simply they have heart problems, breathing problems, other problems that might make them more susceptible to exposure to this or to the virus itself. And that remains true to a large extent, but it is surprising to us as the virus has made its way across the pond to the number of younger patients, or patients who we didn't think would be as susceptible or have such a serious reaction to it. So I'd say the answer to the question is, who's most at risk? It's the people who we would think are most at risk, but the rest of us are not out of the woods. And that goes back to answering the question before, which is that if you are in public, you should be wearing a face covering, and over your mouth and your nose. Doing it over your mouth without your nose doesn't help. Mouth and nose, because as we mentioned, we are clearly learning that the virus can be transmitted from an asymptomatic, meaning someone who has no symptoms, to someone who could be more susceptible. So the answer to who's most at risk, the elderly, immunocompromised, but we're all at risk to some degree, because we may not even know if we have it ourselves. We could be completely asymptomatic and still transmit it.
Right. Yeah, I mean, if you look at the news, there's young people that have contracted it and passed away from it. Yeah. And, perfectly healthy people. And I can't imagine that to me was shocking, because when they're younger or perfectly healthy, it kind of goes against what we initially heard. It just seemed like on the news, it just changed so rapidly from one week to the other. Would you say that even for you being out there on the front lines, that you've seen it just change rapidly, all the different cases that were coming in?
Yeah, I would say that the variety of patient types was much broader than we thought. We thought it's going to be all 70 plus, 80-year-old folks who had susceptibility to any type of virus. But you're totally correct in that we've definitely seen, it's a small cohort, right? It's not the majority of patients, but we have seen many more young folks, young people getting the virus and being impacted than we had initially understood. And some of those people probably had underlying conditions they didn't know about. Yes. And others did not, and they were for whatever reason had a rougher clinical course with the virus.
Right. Yes. So I guess I know that there were people that asked questions and everything while I was offline, so I'm glad about that. I was just curious as the curve starts to flatten, do you see that reduction? Do you notice, I don't even know if I want to call it relief, but do you notice like that with that decline, that is not quite as frenetic as it was in the earlier days. You know what I mean? Where it just like started out and then it ramped up and now it's coming down. Do you feel the difference with the cases?
Absolutely. And there's a few things going on there. So first, you have the shock value, right? The shock value comes in where something foreign, whatever it is, in this case, it's a virus, enters your environment. And so you're immediately trepidatious, you're in fear. And so you'll retract back. And so if they tell you to stay at home, you're like, hell yeah, I'm going to stay at home. I'm not going anywhere. I fear that thing that's out there. And that's scary.
Yes.
But our body, because it's scared, protects itself, which is good. And so we stay home, we wear our masks, we don't go out in public, we don't wander the streets, and that's important. And we are seeing this reduction in the rate, but I don't want people to take that to mean that they should take their foot off the gas pedal. And by the gas pedal, I mean all the things that we've been doing to keep the curve, to continue the curve's decline. And so, yes, I think we should feel somewhat relieved that the rate of transmission is declining, and that's good. And we're starting to see around the country and around the world that businesses, thankfully, are starting to reopen, and life is slowly, but in some places, getting back to closer to normal, which is great. But I want to be very cautious that it is a clear, direct implication of our actions or inactions, which is why that curve never got as high as we thought it would, and it started to decline, such that if we all just decided tomorrow that we're not going to put masks on our faces and we're just going to go out and do our thing and not stay 6 feet apart from each other, the likelihood of it coming back ferociously is significant. So it's good news, but we don't want to lose sight of that good news.
Right. So I'm just going to go ahead and ask you some questions from people watching on Facebook. Sure. And we'll go with Jen. So I'm just Facebook, just so that you know, I'm going with the oldest to the most current questions. So Jen, thanks for watching. How should you monitor the less common symptoms like blood clots, stroke, and heart attack? How do we monitor that? How does that get monitored?
So Jen is very smart. Jen's very smart. You have some smart viewers. So yeah. Jen is talking about the susceptibility with this virus that we're noticing that's creating clots in the blood. And those clots travel to places where they shouldn't be traveling and can cause sometimes minimal and sometimes catastrophic results. So the answer to that question is really to understand your own medical history and your predilection for any of these things, and to be in touch with your physician specifically about how a prothrombotic or a more likelihood event because of the virus might cause you in particular, because we're all going to react differently. There definitely is some discussion around these clots, so I would definitely talk to your doctor if you have a history of something called DVTs or pulmonary emboli or anything like that. Stroke, also the same thing. In general here, we're talking about a clot to the brain for a stroke or a clot to the heart for a heart attack. And so I would certainly suggest, if you have any concern based on your prior medical history, that you should consult your physician. In general, these are not the first signs that you're going to have for the virus. Now, that is not 100% true. So I want to be clear, because this is a novel virus. We don't know everything about the virus, but in general, those are not early signs of the virus. Early signs or symptoms are those that we spoke about previously, such as the fever, the body aches, the cough, the loss of sensation of taste and smell. But it's an excellent question.
Yes, thank you, Jen. So Jen had another question. It was, should you be tested for the antibodies if you never had any symptoms? That's kind of what's, I keep hearing going up for a debate that we're all going to have to be tested for symptoms, or whether we actually have it or not, maybe don't know that we have it.
Yep. So let's talk a little bit about the antibodies. I talked about it a little bit earlier, but let me finish that up again. So initially, the first testing was a nasal swab, and that test told you whether or not you have the virus or you don't have the virus. It was binomial. Either you have it or you don't have it. The test that Jen's referring to is whether or not your body has built up antibodies. So did your body develop parts of the body that would then fight the virus? And we measure those antibodies. And so there's a set of antibodies that show within the first 10 days of whether or not you basically have an active virus. And there's another antibody that builds up over time such that you hopefully, if it were to occur again in the environment, you will have built up antibodies so that you won't have signs and symptoms and illnesses in the future. Now, again, with this virus, the asterisk is there that we don't know whether or not our antibodies will be sufficient if it were to come back. But let's just assume that it was. So testing is very important for us to all get back to our normal daily routine and activities.
Right.
So the answer to her question is that if you're asymptomatic, then you probably will end up getting tested with these antibody testing very soon. They're ramping up testing pretty significantly. As I'm sure Jen and the rest of your audience knows, we were really reserving this initial testing for people who are symptomatic so we could make sure that they isolate themselves. But we are talking now about much broader testing. And so it's likely that you will receive an email or some sort of contact from your primary care physician or other healthcare provider that you work with to get tested in the near future, regardless of whether you ever had a symptom or even if you think you were exposed or not exposed. So probably we'll all in some get tested soon. Yep.
Yes. Okay. Robin has a question about any update on how long people may be contagious after contact with COVID-19.
So the issue with transmission is that we are using our experience that we learned from Europe and China and trying to use that as a surrogate for what we're learning here. And generally the answer is about 14 days is the approximate time that we can transmit. Now, obviously that's an average. So it could be 16, could be 12. We're using 14 days. We're also saying that you should not go back into the public or even hang out with your family members out of isolation until you're 3 days away, 72 hours away from fever that is controlled on its own. So you can't take Tylenol and then not have a fever and count that. That doesn't count. You have to be 3 days of no more Tylenol, no more any medicine that you're taking to reduce your fever. And then in general, we're saying you can reemerge, as they say. But when you do reemerge, you still need to do everything that you were doing before, which is stay in your home, not go out unless you're doing essential activities. And if you do, you should be wearing a mask or other face covering.
Right. Okay. Jen is on fire. She has another question. She wanted to find out if should one use an oximeter?
Pulse oximeter.
Oh, okay. I don't know how to pronounce that. Daily.
Got it.
Daily.
Okay. Daily. Okay. So she wants to know if you should use a pulse oximeter daily. So let's talk a little bit about what a pulse oximeter is and why one might want to use it for the other people listening or watching. So a pulse oximeter is a probe that generally goes on the finger. And what it does is it measures how much oxygen is going through your bloodstream. Mm-hmm. And so the higher the number, the better off you are. In general, it's measured to 100, but it's not a curve like in school. You got to be at a 95 or above in the general population under normal circumstances to be considered that you are not hypoxic or having lack of oxygen. What's interesting about this virus is that we're finding people who are at extremely low levels of oxygen. So that could be anywhere less than 90% and still functioning quite well. And then at some point, maybe they really drop off, but they could be functioning quite well at 92, 91, even 89%, which as a paramedic, if I saw a patient on a regular Tuesday 6 months from now or 6 months ago, that would be concerning to me. And so, like I've always told my patients with the blood pressure cuff that they use at home, you have to use it with some common sense and logic to it. It's an excellent tool to tell you what's going on in your body, but you need to use it with a grain of salt. That is to say that if you feel perfectly fine and there's nothing going on, but your saturation is low, it could be that you have nail polish on, for example, and it's not reading it correctly, or you have it upside down. So you have to take it with a grain of salt, but it is a great tool. I'm not sure that using it on a daily basis provides a whole lot of value. On the other hand, it takes about 3 seconds to put it on and take it off, and it doesn't hurt, physically doesn't hurt. So I wouldn't say it's something you need to use regularly, but it is a good tool if you are symptomatic to see, as a gauge as to whether it's going up or down and based how you're feeling. So if Monday it's 92 and Tuesday it's 88, or Tuesday it's 94, that might give you some guidance as to how you're feeling and how the virus may or may not be affecting you.
Right, right. Josh, have you seen anyone like kind of that was diagnosed positive for COVID-19 actually come back and maybe test again positive? Or have you seen any cases like that?
I have not. So I've seen lots and lots of COVID positive patients who become, tested and become COVID positive. I have not seen anybody come back. You're saying, I think the question is whether or not you can test positive, test negative, and test positive again.
Positive again, yes.
Yeah, I have not. I personally have not seen that.
Okay, all right. Yeah, I was curious about that. So we do have a couple of people on Zoom as well that have questions. Sharonda, would you like to, we could have you chime in. And I think Sharonda's question is, if a person has tested with antibodies, are they still considered contagious as far as 3 weeks without symptoms?
So this goes back to the different types of antibodies that your body puts out. There is one type of antibody that is a marker for actually having the virus actively, and there's one that's a marker that you basically passed, that the virus has passed by you, that you had it and you're no longer symptomatic. And so 3 weeks out in general, if you are asymptomatic, no fever, like we said, and you're 3 weeks out, that's beyond the 14 days and presumably beyond 3 days of no fever. So the consensus right now is that you are not contagious anymore, but should still maintain the same social distancing and mask wearing that everybody else does.
Okay, so I'm going to see if I could allow Sharonda to talk. I'm going to try. Sharonda, do you want to jump on? Do you have any more questions for Josh at all? Hopefully, I'm sure he answered your question, but just in case.
Hi, good afternoon.
Do you have anything else to add? Hey,
Good
Sharonda.
Hey, so thank you. And I appreciate you responding to the question. So yes, so actually my husband and daughter, we all tested. I had active symptoms and my husband had active symptoms about, I would say maybe a month ago. I'm still getting my taste buds and smell is returning, but we did test with antibodies recently as of 2 days ago. But I was just wondering at that point, moving forward, are we no longer out of the window of being contagious? And I thought I knew the answer, but I'm glad you did confirm what I thought. And but obviously, what does that mean to say we have antibodies? Does that mean that if we came in contact with the virus again, would our bodies be able to fight the virus moving forward? But obviously, I know we would still wear the protective, the mask and so forth. But just wondering, what does that look like? As far as
so you're probably well aware of the IgG and the IgM, the different antibodies that you tested for. And so the answer to your question of whether or not you're contagious or not in general, based on what you've described, is that you're no longer contagious. The $1 gazillion question that you're asking is whether or not, since you build up immunity, are you no longer susceptible should the virus come back? I think that's the real question. And I wish I could answer it for you, but we do not know the answer. We believe, based on the fact that you have built up antibodies and that the other viruses that have existed, would be, knocked out by antibodies such as those, that there is reason to believe that would be the case. But we just don't know because nobody has gone that far out from when the virus started. Does that make sense?
Yes, it does. Yes, it does.
What it also brings up, though, Sharonda, is plasma. And this is, let me just talk in general about plasma. And that is to say that they're using plasma from people who have tested positive to the antibodies to help fight the virus in those people who are currently in a tough spot with the virus themselves. And so those people who are IgM positive and IgG negative, meaning that the initial, is negative, the longer term is positive, may very well be eligible, if they're willing to donate plasma, which is like donating blood through the American Red Cross or elsewhere. And that blood, or that plasma from within the blood, plasma is a part of the blood product, can be used for patients who may need that, since it seems to be helpful for extremely symptomatic in-hospital patients who are, in extremis.
Okay. Thank you. Thank
Sure.
you.
All right. Thank you, Sharonda.
Yes,
Appreciate that.
sure.
Yes. Okay. So yeah, that was a really good question and interaction from someone who actually tested positive, not just her,
Yep.
but her family. So that's like a case, definitely. And I was curious about whether someone that tested positive, now recovered and now has those antibodies, if that could be used for the plasma for someone else, maybe that's struggling on a ventilator, or yeah.
Exactly. Yep.
Yes.
Yeah, that's why they are having plasma donation at different hospitals and different faith-based centers in order to try and build up the bank of plasma to be used on some of these patients who are on ventilators or otherwise, requiring intensive care treatment.
Right. Okay. So let me see. I wanted to find out, I guess, as far as going forward, just like what life can look like. You mentioned a little bit like kind of what I envision a month from now is, everybody's going to have masks on. We're going to be doing that for the long haul, the tests and everything like that. Do you see anything additional on top of that? Because what I see now, I live in New Jersey, I work in Manhattan typically. I do envision not just myself, but my husband and I both going back, but maybe not at the I think they said May 30th or 29th. I kind of wanted to give like that extra week or two just for a little insurance, just to make
Yep.
sure the kinks are worked out of the system.
Exactly. Yeah.
And then go in. And so here I'm thinking, okay, I'm already, dedicated to the fact that I will be wearing a mask and gloves. Don't have a problem with that. The 6 feet, more. I'm just thinking, okay, Manhattan, what is this going to look like? Once we're, going back to business as usual. Do you see anything additional that you think that we're going to have to do besides just the testing?
Mm-hmm. So, as you know, I'm a paramedic per diem, as I mentioned earlier. My full-time job is I work at a company called HMP, and we manage the EMS World brand. So I talk to lots of paramedics all the time. We have 40,000 subscribers on our website. 7,000 people come to our expo, and they're all asking and being asked these questions. So the end game is a vaccine, right? So we know that the end game is to have a vaccine that works, that we can inoculate people so that they don't get the virus. Until we have a vaccine, things are going to be different, as you alluded to. And what I think you and I certainly, because we live in New Jersey and work in Manhattan, we see things a little differently than maybe somebody does in, Wilmington, Virginia, or, somewhere in Oklahoma. So things are going to open up. Businesses, life, the world is going to open up at a different pace in different places. Manhattan is a particular concerning place because of how proximate people are to one another. And that could be on taking the train. It could be sitting in a cubicle. It could be going to the Dunkin' Donuts or the Starbucks, whichever you prefer. So it's going to be a little bit different, I think, in Manhattan than you're going to see elsewhere. But I think you're right. We are going to see, for example, in Manhattan high-rise offices, that once people come back, half of them will come back on Monday, Wednesday, Friday, and half will come back on Tuesday, Thursday, so that it's only 50% of people in the office at a time, so that there can be some, I like to call it physical distancing. I really don't like the term social distancing. We need to be more social and less physical. So I'm going to use the term physical distancing of 6 feet or so. We need to be wearing masks if we're going to be in close proximity to people walking into the office kitchen or whatever. So yeah, I think that is going to happen. The governor of New York announced today they're going to be doing extra cleaning on the subways every day. Every car of every subway is going to get cleaned every single day in order to build up the willingness of normal patrons to get back within the New York City subway system, as an example. But places, that don't have aggregation of people in close proximity can probably start to open earlier. And of course, the economy is struggling so badly that it's a yin and a yang. You got to have nobody knows the exact balance there, but we have to have some balance in places where there is less risk, in industries where there are less risk, to try and get the economy going while being very careful to try and make sure that we don't have a resurgence of the virus.
Right. And from what I've read and some of the research that I've done, it looked like, I mean, nobody has a crystal ball with this, right? We don't really know. But what I had read about was the possibility of a resurgence happening in the fall, after the summer. Is that something that you've heard might be something that may happen?
So if we think about general flu, the regular old flu that comes around, it comes around every year. Now we have flu shots and flu vaccinations so that we don't, the vast majority of us don't have problem with flu. But as I'm sure you know, that flu is a pretty nasty bug in and of itself. But we have a vaccine for it, so a lot of people are covered. But there is to say that there is a likelihood that the virus, that the COVID-19 virus, will come back in the fall, just like any other virus will. And that's why it's important to maintain all of these things that we have learned over the past 6 weeks to carry through with them, so that we mitigate any resurgence of that virus coming back in the fall.
Right. So what do you think, Josh, about even other cities and other states? I mean, you alluded to the fact that cities and states that are less populated than like a Manhattan, a New York City, they can realistically open up sooner. I guess the fear that I have, look, I have a lot of family in Georgia and Atlanta. I get a little fearful for them because I'm wondering, okay, are they opening up too soon? Is this going to cause a spread? What's your thinking about, different cities that are maybe opening up before they're starting to see a reduction in the amount of cases that are happening? And when I say a reduction in the amount of cases, it's not just a reduction in the hospital cases, people coming in who are testing positive, but also the amount of deaths that are happening. There's no decrease, but there's now this discussion about, returning back to business as usual with the mask, with the gloves, with the physical distancing. I like that term too. I never liked the social distancing term. I feel like we should continue to be social because we're social beings.
We need to be social beings.
We need to be. It's healthier.
Yes.
But physical distancing, what's your thoughts about, like, other cities, other states, there's maybe not a reduction. There's still hospital cases. There's still deaths that are happening, but they're still getting ready to open up.
So I grew up in Atlanta, Georgia. So I'm with you on that. My father still lives in Atlanta, and I'm worried for him. I think that the decision to open as widely as Georgia did, personally, and based on the things, the information and research available to me, and the practical of me treating so many of these patients, that it seems premature for them to have done that. Now, I understand the immense pressure that the government in Georgia and everywhere must be under. I can totally understand that. But the deaths that occur when we don't do the things that we have been told to do around this physical distancing, the risk is so great of it coming back. It is so transmissible that I'm concerned that opening such as Georgia did will be a challenge for the future of the virus and Georgia. Right. So they did it, right? I'm not saying that I agree with it, but they did it. Yes. So in having done it now, and I'm not saying that they should have, but having done it, it will be very interesting to watch and see what happens. Yes. So it's not the scientific experiment that I would have wanted to see done, right? I mean, but having said that, It will be
Yes.
very interesting to watch what happens over the next 4 weeks with
Yes.
the rates of incline or decline to the virus in those constituencies, those
Yes.
geographies that have relaxed the restrictions.
Right. And then the cities that have very little cases, very hardly any or very low, and or maybe the cases have reduced, the deaths have reduced, then I could kind of see that it makes more sense for them to open back up because of, you know, just how their city or state is structured. They've had less cases, less deaths, or everything's going down. So to me, it makes sense for them to open up. I mean, there's lots of cities and states across the country that haven't seen anything like what we have up here. I mean, we're definitely an anomaly. Yeah, well, most of the cases are up here, but there are places further out west that, you know, they just haven't seen, they've seen very little or very low.
And it must be very challenging for them. So if any of your viewers are from there, we certainly understand how challenging it can be to not be in the environment, yet being held to the same restrictions as the people who are in the environment. And that can be very just, you know, psychologically debilitating and frustrating for sure. So I think I agree to your point, industries where you don't have people near each other, geographies where the virus has not taken a strong foothold, I certainly can see those places opening up earlier. I would suggest and recommend, which I'm sure they will be doing, that they do so in a responsible way where they do maintain the physical distancing, they still wear the masks, but at least getting back into business. I think I saw that New Jersey is opening golf courses on Saturday. So that our first foray into pulling back is opening up golf courses on Saturday is what I just heard.
Wow. Okay. Okay. Here we are. Oh my gosh. All right. So, oh gosh, I could go on and talk to you forever. Josh, you've been fantastic. Thank you. Thank you. Thank you. I just want to just mention Josh Hartman is a paramedic and tour chief, Inglewood Health, and senior vice president, public safety, cardiovascular, HMP Global. So he knows a lot about what's going on with this COVID-19 pandemic. And we just thank you so much for the knowledge that you bring to, you know, to this conversation. It's invaluable for anybody who's watching live or anybody who watched the replay. And thank you for that. I appreciate your time and you taking time out of your day to talk to me and talk to us. So thank you so much. And I'm Debra Dixon Anderson, founder and CEO of Light of Gold PR. We do PR marketing, branding, digital, but we started this Gold Wellness Circle platform really in response to COVID-19 because people still need to keep moving, be healthy, and be mentally well during this time. And we love bringing on experts like Josh because he gives us another view of what do we need to do as we return back to, well, when we return to our new normal, right, Josh? Because it's going to be a new normal. It's not going to be really back to normal. It's going to be to our new normal.
Our new normal.
Yes, so definitely. So we're going to bring you more programs like this. We'd love to have Josh back in the future, maybe, you know, weighing from a different perspective when everything's like, you know, maybe flat and maybe some new things that maybe he's seen. Do you have any closing remarks or any closing advice for us, Josh, as we roll off?
No, I think the only advice I would say is that what I mentioned earlier is that we are going to see some relaxation in the rules. We are going to see some reduction in the rate at which the cases are going to be coming in. And that's a great thing. But we just need to maintain our vigilance when it comes to the reduction in transmission once we are all out there. And so we've really come together as a global citizenry around this, and we need to maintain that citizenry because it's not just about us, it's about everyone. And just even you may be a 16-year-old out there at 7-Eleven that may not even know you have it, but the next person coming behind you on the line is an 82-year-old. So please just continue to be a good global citizen, take care of yourself physically, psychologically, reach out to people if you need to reach out. And thank you for inviting me to participate.
Yeah, thank you so much, Josh. And thank you everybody who's watching or who will be watching. Definitely visit GoWellnessCircle.com. Go ahead and sign up. It's perfectly free. One of our goals is also to do some fundraisers so we can come out and bring some lunches to some of our first responders, you know, or help somebody who's in need. I mean, food is a big issue these days with people who've lost their jobs, and we want to be able to help some folks. So remember, when you contribute, you're helping us to help other people, because people need help right now. We need to be able to do that and just pay it forward. So thanks everybody for watching, and the views from the front line of COVID-19 with Josh Hartman. Thank you, Josh, so much. You have a wonderful day. Have a
My
wonderful
pleasure.
day, everybody, and take care. Be blessed, stay safe, don't get comfortable, stay safe. Masks and gloves, right? That's right.
Take care.
All right, thank you. Take care. Bye-bye.